Good morning, Your Excellencies, distinguished VIPs, sponsors, ladies and gentlemen. It gives me great pleasure to be here this morning. I'd like to start by thanking AHB for inviting the African Healthcare Federation to give a few remarks and, most importantly, to talk about harmonizing action for women's health in Africa. Many of you may not know what the African Healthcare Federation is, but after the flavor of several presidents, I'm sure you get the idea. When it comes to healthcare in African continent, 50% of healthcare is actually provided by the private sector. But when it comes to the voice at the table, a private sector sometimes is invited after the policies have been done. And therefore, we thought that it is important to harmonize the voice of the private sector and come together to be united and realize how important it was to have two sides of the bargain. I speak to ministers of health and I say to them, you're not the minister of public health, you're the minister of health, which means both public and private sector. And it's important that we have a voice and we work together to advocate for the right kind of policies that unlock the potentials of the private sector and, most importantly, bring about patient-centric policies. So on behalf of the president of AHF, who happens to also be the chairperson of African Health Business, Dr. Amit Taka, I would like to also join my voice to first welcome you to this very important summit talking about the new dawn of partnerships for women's health. I think this topic is so incredible, and I want to really congratulate you for choosing this, and also congratulate you, most importantly, for the very successful first summit. And I dare say, by looking at the number of people in the room, the quality of delegates in the room, that this will be a fantastic summit. Now, why women's health? Throughout the ages, we have seen the critical role that women play in society, in developing society and ensuring that nations develop. However, on the continent, we look at what happens to us. And I say us because, as Linda said, I am very proud to be a woman. But we are one of the few important ones that have gotten away with access to quality health. Majority of African women are not in this category. And what are the various challenges? There are many. But it starts first by the fact that we have a higher disease burden than our male counterparts. The fact that we are responsible for reproduction. We also have exposure to cervical cancers. And as Pamela said, Dr. Pamela said, we also have a high risk of both, emotional, sexual, and physical abuse. All of this, combined with the fact that some women also, unfortunately, are not allowed to be educated or do not get a higher education, puts women at a less disadvantage of getting access to quality health. So I'm sure that today at this symposium, we will be looking at not just those challenges, but be focusing on the opportunities that we play. Because of the hat I wear, the role of the private sector is very critical in unlocking those potentials and, most importantly, in changing the narrative. It is important that we leverage on, for example, technology to be able to close that gap. Simple technologies that can pick up postpartum hemorrhage early, to early detection using AI ultrasounds by midwives in the community, to several other things using mobile technology to keep data and analytics. These are things that I'm sure the technology panel will be able to address today. It is important also that we upscale the funding in women's health, not just to have programs, but sustainable programs that will have the kind of impact that we need to get the outcomes to change the narrative for healthcare. Finally, as advocates of healthcare, my fellow advocates, I do believe that we will have a communique as we leave this room today that we can take back, work alongside our governments who are in the room. Honorable ministers, it is a pleasure that you're here with us. This may not have happened 10, 15 years ago. Public sector met separately, private sector met separately. But today we have our ministers, our dignitaries in the room from the public sector, listening firsthand to the things that we collaboratively can do together. So just as the Healthcare Federation of Nigeria president said, as well as our president of FOAPS, the regional president, it is important that we have structured partnerships and dialogue with our ministries of health, that together we formulate partnerships, public-private partnerships and initiatives to be able to change the narrative for women's health in the countries. And I'm sure that by the end of this program, that all of us will leave here really empowered with a lot of ideas that we can take home and work to make a difference in women's lives. Of course, the men's lives too. Thank you very much.